For the past 12 years here in Ventura County, the Perinatal Substance Use Task Force has been attempting to get all pregnant women screened using a formal tool known as the 4Ps Plus. We know that alcohol has devastating effects on the developing fetal brain that can cause lifelong neurobehavioral problems, cause learning problems in school, behavioral problems that wind up in the mental health system, and also, unfortunately, in the juvenile justice system. The long-term effects are just so devastating and are 100% preventable. So over 1,000 children in Ventura County every year are exposed to alcohol and illegal substances before they're born. Our goal remains that universal screening of pregnant women for alcohol and drug use become the standard of care throughout Ventura County.
The month before you knew you were pregnant, how much wine, beer, liquor did you drink?
Maybe a cup of wine every week, once a week.
In the month before you knew you were pregnant, how much do you use any drugs such as marijuana, meth, or coke?
No, I don't use any of that.
In the last month, about how many days a week do you usually drink beer, wine, or liquor?
I'd say maybe just once a week.
I'd like to make a referral to this public health nurse.
You said they're not going to charge me?
No, this is absolutely free.
Okay.
Okay, it won't cost you anything.
Okay.
So we'll go ahead and proceed with the referral.
Okay.
The reason why I'm here today is because your doctor referred you, stating that you had indicated that you'd be interested in having a public health nurse with you during your pregnancy. Does that sound correct?
Yes, that's right.
Okay, great. So one of the things that your doctor had passed on to me is that you had indicated that you drank alcohol during the first part of your pregnancy and now just a little bit once or twice a week. Is that?
That's correct.
Okay.
Only once or twice. I just didn't know it would harm my baby.
Okay. I'd like to share some information with you, if that's okay,
Yes, please.
about alcohol use in pregnancy. So this is a booklet that has been put together by a physician who is specializing in dealing with children who've been exposed to different substances. I'm going to turn to the page on alcohol use. This is really nice because it will explain to you the effects on mom and why we're concerned about you. So what we know with moms that are drinking alcohol is that it can lead to some poor judgment. We all know that even just with diet. We eat the wrong things after we've had a drink or two. Poor eating, and then accidents also. The effects that we see on the baby are too small at birth. The baby can have a small brain and have brain damage. There can be heart problems, kidney problems, malformations, and changes in the face. Sometimes you don't notice any of those things when your baby's born. What we know is the research that has been done shows that when a child gets into school, so not in their preschool years necessarily, but definitely we see it when they get into school, the problems with learning. So we can see anything from mental retardation to learning problems. My goal as a public health nurse is to support the woman to have a healthy pregnancy and to be ready to parent her newborn. Once a doctor has identified a woman at risk of substance use, he or she can refer them to public health nursing. I serve as a resource for the physician in order to assist them in helping the woman have a healthy pregnancy by linking them to the many resources that are available in Ventura County.
A New Start for Mom is a certified perinatal drug and alcohol treatment. We work with women who are pregnant and want to deliver a healthy baby, or women who have just given birth to a baby who want to keep on that track of being drug-free. But all women are able to come here, especially if they have a problem with alcohol, drugs, and have children. We encourage them to be here. Our goal is to address the whole person, not just the addiction, but the mind and the body. Because we are a full-service treatment program, we deal with life problems because most people start drinking or using drugs because they don't have the skills to live life on life's terms.
And I started self-medicating on pain meds, thinking, well, they're prescribed, so they're okay. And then I started mixing it with drinks, and after a few years, I knew, I had enough sense to know that I had a problem. One thing led to another, and I was introduced to meth, and that's the only thing that made me feel better. So I thought, well, you know, I'm getting up and I'm taking care of the kids. Shortly after I was introduced to meth, my kids were taken. I ended up in jail. I lost my home, I lost my career, I lost my children, and my family fell apart. And then I got out of jail, and one of the objectives that I had to fulfill to get my children back was to take an outpatient rehab. Going through the New Start for Moms program opened up a whole new world that I never knew existed for me. I learned relapse prevention. First, I learned that I had a disease, that if I didn't deal with the issues of the past, then I was never going to move forward. Some of the things that I did in the New Start for Moms program is I got one-on-one counseling with one of the therapists here, and I was able to talk about different issues that maybe I didn't want to share in a group. Also, we had assignments that we did every week on parenting and anger management. They held us accountable by random drug testing. I also graduated, and at each stage of graduation you get a quilt, and I got a quilt, and that quilt I actually handed down to my granddaughter. So thanks to community organizations, especially for me, would be New Start for Moms. I am clean and sober 4 years now, and I'm giving back to the very same community that gave me what I have today, which is my sobriety, my children, and my faith.
The Ventura County Perinatal Substance Use Task Force mission is to ensure that all children born in the county of Ventura are born free of substances like alcohol, tobacco, and other illicit drugs. Members of the task force include Public Health, the Human Services Agency, Children and Family Services, local hospitals, behavioral health, alcohol and drug programs, as well as our local First Five. Our goal is to spread the word about perinatal substance use and the impact that it has on children. We want to educate the community as well as providers, physicians, nurses out there in the community about the impact. Some of the outreach activities that the Perinatal Substance Use Task Force provides are educational forums and seminars for prenatal care providers in their offices as well as at the hospitals. We speak to their nursing staff, we speak to physicians, and what we talk about is the impact that perinatal substance use has on the child and what they deal with lifelong with being exposed to these various substances.
The benefit of using the 4Ps Plus program is we are able to identify these women who are using or at risk for using drugs and alcohol. It really doesn't take any extra time to do the 4Ps program because our CPSP workers will identify the patients and work with me to do the public health nursing referrals. Those nurses go out and meet with the patients. They educate them on the dangers of the drugs and alcohol that they might be using. They are able to get them into programs if needed to help them stop using. Oftentimes the public health nurses will come to the office and they will meet with my patients before I meet with them or after I meet with them for their regular OB visits. I usually am able to talk with the public health nurses. We can discuss where we need to help that patient. I find that when my patients work with the public health nurses, more often they're going to stop using if they have been using during pregnancy, and oftentimes they're set up with outpatient therapy or counselors so they can continue staying clean and sober after the baby is delivered. I encourage other physicians to use the 4Ps program because it really helps identify these patients and that will help them have healthier pregnancies and healthier babies.